Welcome back. Suicide is a major health problem with far-reaching social, emotional and economic consequences. It is estimated that there are currently more than 700,000 suicides per year worldwide, and we know that each suicide profoundly affects many more people. Creating hope through action is the triennial theme for the World Suicide Prevention Day from 2021 and including this year of 2023. This theme serves as a powerful call to action and reminder that there is an alternative to suicide and that through our actions we can encourage hope and strengthen prevention. Suicide Prevention Month is during the month of September, while Suicide Prevention Day is commemorated every year on the 10th of September. Now joining us from the Ministry of Health is Alice Umurerwa, who is a Chief Social Worker, to talk to us about the Ministry's collaboration with Childline Lifeline Namibia on the Suicide Prevention Campaign. Alice, good evening, and thank you so much for joining us.
Good evening, Nina. Thank you for having me.
Lovely having you here.
Yes.
I want to start by looking at some, stats, Alice. And what do the statistics tell us about suicide and of course, its prevalence in Namibia?
Okay. Current statistics are showing us that suicide is on the rise in Namibia, especially amongst men. Generally, it is rising. We are getting a lot of completed cases, reports of completed cases, as well as attempted suicides. So it is a concern for the ministry and for Namibia at large.
And that was going to be my next question to you. That I've observed, and I don't know if the general public has also, that it seems that suicide is on the rise, especially amongst the male population. But do we have any insight as to why that is? And of course, as you mentioned, it is a fact.
Generally, it was always men. Even if we look at the past statistics, always the completed cases were always men. It was more men than women and more male youth than female youth. However, this year, it's higher. It's higher than every year. We don't know, we don't have real research where I can say this is the real reason why men are taking their own lives. However, it could be because of societal pressures. It could be because of the high rate of unemployment. In African cultures, we expect our men to be providers. So it could be that when a man feels that I cannot provide, they don't feel adequate anymore, and that could be the reason why they decide to take their own life.
And how often do mental health issues or mental health, illnesses play into that?
It's one of the contributing factors, because you might find a lot of people are suffering from a mental health condition, whether it is diagnosed or undiagnosed, and they don't have another way out. It could be diagnosed, but they're not adhering to the medication, or they have not accepted the fact that they are having a condition, or they just generally do not have any kind of support. And this could lead them to taking their own lives or attempting to take their own lives.
In general now, amongst men, women, young people, what are the factors that would put one at risk for suicide? What are the factors at play here?
There are many factors that could contribute to it, but all forms of abuse. This could be physical, emotional, sexual, any kind, economic abuse. This could lead to somebody deciding to take their own lives. Societal pressures, especially after the COVID pandemic, we really saw a lot of expectations that were put on people, and it could be financial expectations that they do not feel they can meet, and you just feel inadequate. Family relationships, whether it is with your partners, whether it is with your parents, with your children, peer pressure, and one of the biggest ones, which is a big problem in Namibia, alcohol and drug abuse. Sometimes you drink trying to hide or to suppress a problem, and then you wake up realizing now I have even made it worse because this is where I've ended up. And then depression and other mental illnesses.
What will the ministry's suicide prevention campaign entail, Alice?
So last year, the ministry started by combining two very important days. This is the Day of Suicide Prevention, which is the 10th of September, as well as the Mental Health Awareness Day, which is the 10th of October. So we made it a month-long commemoration.
Right.
It starts on the 10th of September. It goes on until the big event, which is the 10th of October. So we want to talk about mental health. We want to talk about suicide. We want to talk about the self. We want to talk about community. We want to talk about families. We want to talk in general about you and about me, you know, during these campaigns.
Yeah. So what activities do you have lined up for this month-long campaign?
Okay, so we are starting, the ministry also has a national suicide prevention and treatment action committee. So we've got one at national level, which is in collaboration with different stakeholders, including Lifeline, Childline. And the regions have also their regional action committees. So the activities which are happening or the strategies which are being developed at national level are then cascaded down through to the regions as well as the different communities.
Yeah.
So for this year, the national one is starting with the activities. So we are having a short session on the 11th of September because the 10th is on a Sunday. So on the 11th of September at the head office of Ministry of Health and Social Services, we will have almost like an opening of this campaign where our minister will be present, and he's also going to give a speech on suicide and the position of the ministry. And then the regions are going to have aggressive awareness campaigns. These are in the communities, at schools, workplaces, as well as shopping malls. So you might go in Oshana and you'll find them at ShopRite, and then you go into Karas, you'll find them at Spa. So they will be there, and it's mostly our social workers who are spearheading these. But the different stakeholders are also going to have different activities at their own workplaces targeting employees. So it is a range of different activities. We will try our best also to share them on all different media platforms.
Fantastic. And just lastly, Alice, of course, you mentioned, of course, the host of contributing factors, and I think a lot of times, whether it's alcohol and drug abuse, you know, as you mentioned, whether it's that you've got a mental health condition, the issue also sometimes is that people don't know where to go for help.
Yes.
And I'd like to for you to talk to us about, you know, if you are struggling with any of those, where it is that one can go and seek a safe space, a non-judgmental space, where you can find some assistance.
Okay. The Ministry of Health and Social Services, being the biggest service provider when it comes to mental health treatment as well as psychosocial support, you can get services at any office that has a social worker. So this can be at any district offices, it can be at some of our clinics, it can be at some of our health centers as well as the hospitals. So even our nurses, we are busy training all the nurses to know how to identify someone who is at risk and make referrals. So the ministry in itself, wherever you enter, where there is a Ministry of Health and Social Services, you are going to get an ear. If they cannot actively help you, then they will take you where you can get the active help. But not to leave out the other stakeholders who are also involved. We've got private organizations, community-based programs who are also giving services in different regions. And during this month, all the regions are going to share all those numbers and so forth. But one of the biggest one is Lifeline Childline, because they have a toll-free number where anyone can SMS them, anyone can call them and get assistance, and that is the 106 and the 116 numbers. So if you attend to them, or if you call them, they will attend to the crisis, and if you need further assistance, they also make referrals, whether it be to the Ministry of Health, to the social workers or psychologists, or any psychiatric help that you might need at that time. Yeah.
Well, thank you so much for being here this evening, Alice. It was lovely speaking to you.
Thank you so much for having me.
Thank you. Well, there you have it. We were speaking about Suicide Prevention Month and the Ministry and Lifeline Childline's month-long campaign that they will be embarking on. Suicide Prevention Day is on the 10th of September. And of course, as Alice did mention, should you need assistance, if you know anybody that needs assistance, please do call these toll-free numbers, 106 116. Really easy to remember. We'll be right back after this. Stay with us.